There's my audience. Um, Superior mesenteric artery syndrome is a disease that affects around 0.013% to 0.3% of the U.S. general population. This statistic qualifies it as a rare disease. According to NORD, which is the National Organization for Rare Disorders, a rare disease is one that affects fewer than 200,000 people. This number is not one that's set in stone, however. There are some diseases that are considered, on a global level, not a rare disease. Even with this, they are still included in their category of rare diseases. Not only do these affect a small number of individuals, but they can also have a profound impact on affected individuals. Depending on the severity of the disease, some of these impacts include major economic burdens due to treatments and prolonged hospital stays, severe mental and emotional stress of not knowing what's wrong or feeling defeated when things are not getting better. And finally, it's having the challenge of getting care from doctors because they don't know much about the disease or how to treat it. Due to this lack of knowledge, there's not always a lot of treatment options available. This can weigh heavily on the patient or make them feel hopeless. Now, I say all of that to give some background information so that the rest of the speech makes somewhat sense. So the main disease that I want to focus on is superior mesenteric artery syndrome. Like I stated earlier, SMA is considered a rare disease because of the small amount of the general population that it affects. It's a disease that typically only occurs in younger women. This happens due to the patient's natural anatomy, a spinal injury or surgery, or a growth spurt in height but not weight. There are several different causes, but these are just a few of the common ones. SMA has a wide variety of symptoms. Due to this, it can be kind of hard to detect the disease unless it's caught at the right time. According to NORD, some of these symptoms are nausea, vomiting, abdominal pain, indigestion, and early satiety, or the feeling of being full even when only a small amount of food or drink has been ingested. These symptoms are caused by what part of the intestinal tract it affects. The syndrome is caused by the compressing of the duodenum, which is the first part of the small intestine and directly connects to the stomach. This compression that causes an obstruction is what causes the symptoms to occur. Now, the symptoms that are brought on by the syndrome can be similar to other diseases or syndromes. These similarities is what makes it hard to find. There are only a few tests that can be done that will find and diagnose the syndrome. One of these is the hypotonic duodenography test. In this test, barium is ingested or injected into the stomach with a fluoroscopy that will follow the barium into the small intestine. The way it's detected is if there is a delay in gastric emptying. Now, considering SMA is a rare disease, there are only a few treatment options. In an article about superior mesenteric artery syndrome by Nicole Van Horn and Jeremy P. Jackson, they say that the initial treatment is typically conservative and non-operative. Doctors will usually try and have the patient gain weight via high-calorie liquid diet, and then if that fails, an NJ tube is next. If that still fails, a TPN can be inserted. Weight gain is what is needed to restore the mesenteric pad to further the distance between the aortal artery and the superior mesenteric artery, which is what causes that compression and obstruction. If all these treatments still fail, surgery is typically the most successful treatment. This treatment is a surgical procedure that creates a new pathway for food to travel from the stomach to the small intestine, which the name of that is laparoscopic duodenostomy. So if you were not too sure on what qualifies a disease to be considered rare, these are just some of the few characteristics of what those qualifications are. And now you can say that you're a total expert on one rare disease, which is superior mesenteric artery syndrome.